Chapter 4, Segment 2. The effects of a drug depend on its site of action and dose. The term drug is used in many ways. A common definition is a medicine used in the treatment of a disease. These include prescription drugs and over-the-counter drugs. Psychoactive drugs, which alter the function of the brain, also fall under this category and can be helpful in psychiatric settings. Psychoactive drugs can also be used recreationally, which can cause health risks, and these are drugs of abuse. Drugs fit like keys in molecular locks. It is possible to develop drugs that interact with one or few receptor subtypes. Evolution often affects the structure of receptors more than transmitters. Drugs fit in a specific subset receptor. When the drug binds to the receptor, it alters the activity of the receptor, activating or blocking the receptor's response. Drug receptor interactions vary in specificity and activity. Drugs have flexibility when it comes to receptors. Binding affinity is a degree of chemical attraction between a ligand and receptor. Drugs have high affinity for a particular receptor. Drugs with high affinity with a particular receptor allow drugs to bind to receptors even at low doses. Efficacy is a degree at which a drug activates a response when it binds to a receptor. Agonists have high efficacy and antagonists have low efficacy. Partial agonists are drugs that produce a middling response, and a combination of affinity and efficacy determines the overall action of a drug. Dose-response relationships reflect the potency and safety of drugs. Larger doses increase proportion of receptors bound by a drug. An increase in receptor binding increases the response of a drug. Dose response curves are graphs that show how a dose given affects the drug's effects. Pharmacodynamics is a functional relationship between drugs and their targets. Repeated treatments may reduce the effectiveness of drugs. The body is adaptable, and drug tolerance is when a drug's effectiveness diminishes over repeated treatments. Metabolic tolerance is when the body's metabolic systems and organs eliminate the drug from the bloodstream before it has a chance to affect the brain or another target. Functional tolerance is when the target tissue shows a decrease in responding to a drug. And regulation of receptor proteins, changing the number of receptors in the cell membrane, is important for functional tolerance. Exposure to agonist drugs can cause neurons to downregulate, which decreases the number of available receptors to which the drugs can bind to, becoming less sensitive to the drug effect. And if a drug is antagonist, target neurons may upregulate, which increases the number of receptors, becoming more sensitive. Cross-tolerance is when tolerance for one drug can lead to tolerance for another. Withdrawal symptoms are unpleasant sensations that occur when one stops using the drug. And sensitization is when the body shows an enhanced response to a given drug after repeated doses. And these withdrawal symptoms and sensitization are what continue to cause drug addiction. Drugs are administered and eliminated in many different ways. The way a drug is administered determines the amount of drug that reaches the brain and the speed at which it starts acting. Smoking and intravenous injection rapidly increases concentration of the drug in the body that is bioavailable, meaning that it is free to act on target tissue. In oral ingestion, buildup is slow over long periods of time. Duration of drugs' effects is determined by the way a drug is metabolized and excreted from the body. Biotransformation is when enzymes convert a drug into a metabolite that is active. This leads to unwanted side effects. Drugs can be stored in depots, reemerge, and have physiological effects after long periods of time. Pharmacokinetics are factors that affect the movement of a drug into, through, and out of the body. And the blood-brain barrier inhibits the movement of large molecules out of the bloodstream into the brain. And this often blocks drugs that are important experimentally and clinically. Drug effect affects each stage of neural conduction and synaptic transmission. Local anesthetics block sodium channels to stop neural transmissions in pain fibers. Some drugs after presynaptic events. A drug may change synaptic transmission by modifying the behavior of the presynaptic neuron, changing the system that converts an electrical signal into a chemical signal. And the most common presynaptic drug effects are effects on transmitter production, effects on transmitter release, and effects on transmitter clearance. So, transmitter production, 3 of the main effects are inhibition of the transmitter synthesis, blockade of axonal transport, and interference with the storage of transmitters. And for transmitter release, 3 main problems are prevention of the synaptic transmissions, alteration of synaptic transmitter release, and alteration of transmitter release through modulation of the presynaptic activity. For transmitter clearance, the 2 main effects are the inhibition of transmitter reuptake and the blockage of transmitter degradation. Drugs may act postsynaptically, so drugs affect synaptic transmissions to modify the activity of postsynaptic cells. And the 2 major classes are direct effects on the transmission receptors and the effects of cellular processes within the postsynaptic cell.